Placement of an intravenous catheter in the horse. There are many reasons for placing an intravenous catheter to administer drugs or perhaps prior to anaesthesia. Firstly, an appropriately sized area is clipped in the horse's neck to allow you to see the vein and to remove surface contamination. Care should be taken to make this area as neat as possible. An initial scrub is performed using chlorhexidine solution or heavy scrub. This removes the initial amount of contamination on the horse's skin in preparation for local anaesthetic. The scrub should continue until there is no contamination on the swab. Approximately 2.5 mL of local anaesthetic solution are injected into the skin overlying the jugular vein. Enough solution is placed to allow for the catheter and for the sutures which will secure the catheter in place. A small needle is used which causes minimal disturbance to the horse. Following placement of local anaesthetic solution, the surgical scrub is completed. The catheter is grasped in one hand and pushed into the vein, with the bevel of the catheter facing out. One hand then grips the stylet and the catheter is slid down the stylet and into the horse's vein until it is flush with the skin. Care should be taken not to remove the stylet until the catheter is fully up against the skin. A bung is then placed on the catheter. The catheter is secured in place using 2 or 3 sutures, which are placed using an intravenous needle through the skin and then placed through the eyes on each side of the catheter. In some cases, a third suture is placed around the neck of the catheter. A one-handed tie or surgeon's knot can be used to secure the catheter in place. A second suture is placed in a similar manner to the first. It is useful to avoid trying to place the suture through the skin and through the eye of the catheter, as this often leads to the catheter being partially pulled out or kinking at the interface of the skin and catheter. In some cases, an extension set is applied to the catheter. The extension set is tightly screwed onto the catheter and then flushed with heparinized saline solution. At this point, it is possible to check if the catheter is still in the correct place by drawing blood back into the extension set. A bung is then placed on the end of the extension set.